today we're very pleased, excited, and honored to interview Dr. Mimi Guarnieri. She is the world-renowned integrative cardiologist. She's ranked number 6 of the top 100 integrative physician by Newsmax. She leads her team of experts as co-founder and medical director at Guarneri Integrative Health in La Jolla, California, at the Pacific Pearl, La Jolla, the premier center combining state-of-the-art conventional, integrative, and natural medicine. She's board certified in cardiovascular disease, internal medicine, nuclear cardiologist, and integrative holistic medicine. Dr. Guarnieri is president of the Academy of Integrative Health and Medicine, past president of the American Board of Integrative Holistic Medicine. She currently serves on the founding board of the American Board of Physician Specialties in Integrative Medicine. Dr. Mimi Guarnieri is the recipient of numerous awards, including the prestigious Linus Pauling Lifetime Achievement Award by the Functional Medicine Institute and the Bravewell Lifetime Achievement Award in Integrative Medicine. How come I feel like I did a workout? I'm so pleased, my husband and I, to introduce Mimi Guarnieri to all of you.
Yes, we're very excited to interview Mimi. I've known Mimi for many years, and she and I have a very common background. We were both interventional cardiologists, and we'll talk about Mimi's journey from interventional cardiology to the president of the Academy of Integrative Health and Medicine. Also, how she worked with Dean Ornish to create programs for cardiac reversal of disease, lifestyle medicine and what that means. And she'll also talk about her concept of disease as fruits on a tree. And if the fruits are disease, you have to really get to the fundamental reason in the soil of that tree of why that disease occurred. And that's the best way to really heal. We'll talk about the mind, body, and spirit, emotional effects and cortisol levels and how they affect health, genetics, and how our genes are not our destiny. We'll also talk about the broken heart syndrome, how community affects health, and how loneliness is a major risk factor for disease, and how good relationships can result in actual improvement in things like cholesterol, high blood pressure, and your response to medications. Her initial approach and how she starts with the very complex change in lifestyle and the simple changes she makes to make this journey as easy and acceptable as possible for the patient, how she motivates patients to change. And also, finally, we'll talk about the Daniel Plan, which was an interesting study in a group and changing their diet and lifestyle with significant health outcomes. So without further delay, let's have this beautiful interview with Dr. Mimi Guarnieri. Well, Mimi, thank you for participating in our interview. I'm thrilled because as a former interventional cardiologist like yourself, we have very similar backgrounds, and our listeners are very interested in what integrative medicine is. As the president of the Academy of Integrative Health and Medicine, you're an expert in this. So I would love to have our listeners hear what your journey was to get you to that point, because I know that you were doing a lot of interventional work, in the cath lab, really doing the hard work of treating problems. But, the basic idea of integrative medicine is more prevention and reversing of disease and actually getting to the fundamental causes of things. So I'd like to just hear your journey to this.
And I want to start saying to you, thank you very much for having been so inspirational to my husband. He has a great respect for you. He followed your journey and has been a spiritual awakening for him, besides a education awakening. So thank you.
Thank you, and thank both of you for having me. You hit the nail on the head, right? You said we both started in intervention. And so when you get trained in medical school, it's all about what's going wrong right now and what drug or surgery can we do to fix it. And neither of us were trained in preventing cardiovascular disease or any disease in the first place. So I used to put in literally 700 stents a year in the late 90s. And I never for 1 second connected the concept that prevention could be as strong as intervention until I started to do some research with Dean Ornish. And at that time, we were teaching people nutrition, yoga, meditation, getting them to exercise. And as a cardiologist, what I witnessed was shocking. I mean, people were losing weight. Their energy was better. Their relationships were better. They came, they had a smile on their face. Their cholesterol was going down. Blood sugar was better. Blood pressure was better. And I thought, oh my God, all this time, we've been missing the whole prevention side of the equation. So now I like to think about it as really whole health, taking care of the whole person, body, mind, emotions, and spirit. And for me, the foundation is lifestyle medicine, right? How do we live our life, right? What do we eat? Our macronutrients, getting a good night's sleep. We know greater than 7 hours is linked to health. Less than 7 hours is linked to disease. Toxins, stress, depression, community, social connection, all of these things we now know interact with our genes and determine whether we stay well or we become sick. So I really love to use lifestyle medicine in my practice, and also the tools, if you might, of functional medicine and all the global healing traditions. Because in Western medicine, we didn't learn everything that we needed to know.
Absolutely. One of the things I wanted to just clarify for the people who are listening, what is a stent, right? That you said I put 700 stents per year. What did you exactly do? And then, talking a little bit more about functional medicine. What is the difference between traditional medicine, what we call traditional medicine, and functional medicine?
So I like to call it conventional medicine. And when I say I put a stent in, there'd be a blockage in an artery. And a stent is like a metal sleeve that's a scaffolding that holds the artery open. But what a stent does, it only fixes, 20 millimeters or 30 millimeters of the artery. And it's great because if you're having a heart attack, you may need that stent at that time. But then we have to say, how do we prevent this disease in the first place? And how do we, if someone's already had a cardiovascular event, whether it's a stent or a stroke or, blockage in the arteries to the kidneys or the legs, how do we reverse that process? And that's really where I like to spend my time now, is giving people the tools that they can start to use to begin to reverse the process, including medications when we need it.
Yeah, most heart disease is an epidemic, and I always get the question of why are we treating lipids? What's happening? Why do we have high lipids in the United States and other Western countries? Is it just what we eat, or is it a combination of things? And we know from a lifestyle medicine standpoint that it's a combination of things. It could be stress from as a child, stress as an adult, what we eat, lack of exercise, smoking. So I think this is the approach, but what is the approach in terms of lifestyle medicine, in terms of people with advanced disease like diabetes and heart disease?
Right. So the way I teach it to my patients is I say, imagine you have a tree in your backyard and you look at the tree and you say, my tree looks a little sick. What are you going to do? Are you going to just keep chopping off the branches of the tree? We know that doesn't fix the problem. Or are you going to fix the soil? And my patients will always say, if the tree is sick, maybe it needs more water, more sunlight, miracle grow, whatever it is. So you said diabetes, right? So let's say someone does have diabetes and you say, okay, the sick fruit on your tree is called diabetes. Now let's go into the soil. What you eat, do you think your macronutrients, your choice of carb, fat, protein affects your diabetes? My patients almost always say yes. And then micronutrients, a lot of people don't realize that if you're depleted of magnesium, chromium, it will make your diabetes, or glutathione, it will make your diabetes worse. So there's macro and micronutrients. People who have sleep apnea, they snore, they stop breathing, or don't sleep at night, less than 7 hours, much higher risk of diabetes. We also know that herbicides and pesticides have been linked to mitochondrial dysfunction, that's the powerhouse of the cell, as well as diabetes. So I always like to say, let's take it from a body, mind, spirit perspective. So for the body, we can change the macronutrients, the type of foods we eat. We can deplete the minerals we may be missing, whether it's, chromium or magnesium. We can work on the sleep aspect and the physical activity aspect, right? Because we all know that as we exercise, we consume sugar, we make the muscle a more efficient user of sugar. So there's lots we can do for diabetes. And then we look at the emotional side as well, because if you're under a lot of stress and your body is producing a lot of a hormone called cortisol, that cortisol will make you gain weight in the midline, which makes your diabetes worse. And that cortisol itself is a steroid, which increases diabetes. So if we look at the whole picture, we say, okay, we have a sick fruit called diabetes. This is what we can do for lifestyle medicine. And I always teach the patients also, the trunk of the tree is the genetics. I like to think of that like the DNA. So you may have the genes for diabetes or high blood pressure, but it's how you live your life that's going to impact that.
So a lot of patients ask that specific question. My father had a heart attack. My grandfather had a heart attack. So I have the genes. There's nothing I can do. And that's not true. We now know that's not true, correct?
We know our genes are not our destiny as it relates to cardiovascular disease. There are some genetic problems that we have yet to solve, like a family that has Huntington's chorea, for example, right? We don't have a magic bullet for that. And maybe we will when we start doing gene splicing. But the genes, as it's related to cardiovascular disease, whether it's for cholesterol or diabetes, all of the high blood pressure, there's things that we can do right now today to transform that. And I think that's the work that you and I are really putting our energy and our effort into.
And then there is the emotional component, right? That is extremely important. And we have seen that more and more since COVID.
And you wrote the book, The Heart Speaks.
Right. And, the heart does speak. I mean, we talk about the heart, and you know this, we talk about the heart as an emotional organ, right? My heartache, broken heart. In cardiology now, we talk about broken heart syndrome, which every cardiologist now recognizes. And we know that when the body is stress produces stress hormones that raise blood pressure, make the platelets sticky, raise the heart rate, cause the arteries to constrict. So, we know the stress hormones all day long are not good for the heart. We know cortisol is not good for the heart, causes diabetes, high blood pressure, puts weight on people. And we also know that things like depression may lead to behaviors that aren't healthful. How many people say I'm depressed and I have 20 friends in this pack of cigarettes? Or I'm depressed and I feel better if I eat these Cinnabons, right?
Or I drink some alcohol, or I take a drug, right? Because partly what these things do is also substitute loneliness, disconnect. And that is what has happened that we have seen with COVID. At the beginning, a lot of people started exercising a little bit more, cooking more at home, started doing better. And then the isolation came. the disconnect with other games. And we see the opposite. That the people became more depressed, less motivated. That disconnection, the loneliness, the disease of loneliness, I think that is probably one of the hardest one for us to ask patients about and help them with, because there are very low resources for it.
And I think in the United States, we do this particularly bad, right? I know when I grew up in an Italian household, my grandmother was in the house. We had aunts and uncles in the house. We kids were running around. We had a 3-generational family. There was always someone cooking in the kitchen. There was always someone at home. Whether you were the oldest or the youngest, you were surrounded by community. And we saw that in a study that was done on the Italian community, for example, in Roseto, Pennsylvania, right? They were smoking cigarettes, they had a high cholesterol, and yet they weren't having heart attacks. And the researchers said, well, a lot of it is their social network, their community. So you're right. And the research shows that loneliness is as bad as smoking 15 cigarettes a day, being an alcoholic, not exercising. It's as much a risk factor as those traditional risk factors that we talk about all the time.
And there's science behind connection and love in medicine. And there's I think there's some studies showing that these things that we never really paid attention to in the past are as important, or maybe even more important than some of the risk factors that we look at, like lipids and other things. And I think some of these studies are fascinating.
I agree with you. I mean, we know, for example, that, you and I are cardiologists, Giovanni, and the research shows, and there are studies that show if you have a good relationship with your patient and they feel connected and they feel that they believe you're really there to help them, they come in with better cholesterol levels, right? Better hemoglobin A1Cs, better blood levels. And right?
They respond to medications better, right? So they have a better response because they trust. So partly what happens is the difference between curing and healing, right? When we become a healer instead of a doctor, that just gives the cure, right? That we are healing. And that is with that connection, we can be healers.
Yeah, it's funny in my office, and if my front staff listen to this, they'll crack up, because I always tell them, art of healing starts with you. Smile, be friendly, because the healing of the patient coming into this office starts with you before they see me. And I think it's very important. And I find that to be very true. My patients always tell me that they feel better because of the interaction, of this friendly interaction.
Absolutely. It's creating a healing environment. And we know, again, that, Jerome Groopman, I believe it was, Groopman, who did a lot of research on the healing experience, as Sandra's saying. And what's fascinating is he said, people come to physicians, to psychologists, to any provider with wanting hope and alleviation of suffering. Most people don't wake up and say, I'm going to a doctor today because I have nothing better to do, right? Is there some hope here? Can they alleviate my suffering? Can I feel better, whether it's emotionally, mentally, physically? And who we present in that room, right? And like you said, my front desk, my office, the people, are we loved? Or are we, sort of like sometimes you go to airlines and you feel like you're interrupting them because you're flying on the plane, right? I mean, are we loved? And what are we bringing to the exchange? And when you give somebody a prescription, the research is fascinating. If I give a prescription and I say, well, I have this, maybe it's going to help you. Maybe you're going to have side effects. Maybe your hair is going to fall out, whatever it is. Believe me, they're either not taking it or it's going to be effective, as opposed to, hey, this is great. This is going to make a difference. This is going to improve your heart muscle function. Now, that's a whole different energy, right?
Right. So is what we believe as physicians, as healers, which is in the first, like you said, making that first connection, to let people know we care. We absolutely care. And I, as a physician, have been into doctors' offices many times when I've never felt that, not even for a moment. You felt being rushed, the stress that the doctor is experiencing at that moment is not a healing environment. Same thing in hospitals, right? Is the all, place. So how do we create these communities, these healing environments? How do we teach other doctors to be healers? And how do we help others to start early? Because one of the things we unfortunately see, I'm a child psychiatrist, so treating kids in environments like you were describing, the school environment, when they have to, necessarily, sit for kids being in the same closed-in environment, sitting down, not going outside, not eating well. We have to start early, but how do we teach people? How do we do this better?
Yeah, so I think one of the first things is we have to, when we look at clinicians, we have to respect that post-COVID, we are down over 300,000 healthcare providers, over 100,000 physicians, many nurses have left healthcare, respiratory, and there's a huge stress on people that are still here, right? And there's a lot of talk with the American Medical Association about burnout. And, I think we're at a point where in order for us to heal others, we have to heal our own profession as well, right? So like at the Academy of Integrative Health and Medicine, we're talking about healing the healer, right? What can we do to keep ourselves healthy, right? Because you're right. Nobody wants to come into a flustered physician with 30 people waiting in the waiting room. I think what would be healing for everyone is if we started to teach lifestyle in groups. I really believe, after all my research with Dean Ornish, as a cardiologist, I used to take a back seat and I used to watch my patients get better and better meeting with the group 3 days a week, where they would go to yoga and meditation for an hour. They would learn how to cook. We had a cooking school. They'd meet with the nutritionist. They'd sit in a support group with a psychologist, and they'd exercise. So 4 hours, 3 days a week. And I rarely got called, right? The nurse was running the show. If there was a problem, they'd come and find me. And people got better and better. So I think the model that we're using right now of this one-on-one, trying to shove one more patient into the doctor's appointment, time and schedule, I don't think that's viable anymore. I think, somebody's having chest pain, they need to see one of us, an MD. But all of this education around food, around nutrition, around fitness, around mind-body medicine, learning to breathe. You mentioned heart math when we were talking earlier, learning to breathe, learning to transform the stress response. All of this can be done in groups, and it can be done as part of community-based education. And I think that's where we have to go.
I agree. We have to have more than that. And also we have to start early. We have to teach the students, we have to teach the kids, we have to teach the parents, and we have to teach the family. We have to change universities, cafeterias. We have to help young adults to recognize what it is that they need to eat and how to understand the trap of the advertisement of food. How do you get hooked so easily? There is no difference. But, we go after cigarettes company because they're hooking young kids, young people, but we don't go after the food company that hook kids and adults so early on into becoming so dependent on these foods. They're so addictive.
How many people just don't know? How many moms give their kids fruit juice thinking, okay, that's better than giving soda, as opposed to let me give the whole fruit, right? People, or white rice versus brown rice, right? People really don't know, and we're not helping them with the way we market things, because we're marketing just to sell, right? And we have to also look as a government what we subsidize. We don't subsidize organic fruits and vegetables and nuts and seeds and legumes, but we subsidize corn, which becomes high fructose corn syrup, and KFOSs, where the animals are not grazing on grass. So we need a whole overhaul of the way the world is doing things, and hopefully it will happen in our lifetime.
That would be nice.
Yeah, there's so many things that and that's a question. How do you approach? When there's so many different things to do with the patient. What's your approach to in starting? Because they can't do everything, right? Wow.
Right. You can't do everything at once, but what I usually almost always start with food first. Usually I'll end up starting. I truly believe that if you have a healthy gut, sort of like we teach in Ayurvedic medicine, if you have a healthy gut and you have the right food, you probably don't need medicines. And if you have a gut that's not working right, and you have a lot of inflammation and heartburn and gas and bloating, medicine's probably not going to help you, right? Because you're not even processing what you're eating or taking. So I always start with the gut first. And because I'm a cardiologist, I'm always looking for hidden sources of inflammation. And that inflammation may be starting in the mouth, gingivitis, dental disease. It may be sleep apnea causing inflammation. It may be the gut causing inflammation from eating too much sugar or too much dairy or something you're sensitive to, gluten or corn. So I always go to the gut first. And even if I can just clean the diet up a bit while I'm waiting for tests to come back in. And alcohol, I don't say stop all your alcohol. I say let's decrease it 50%. People that are drinking 4 and 5 Coca-Colas a day or more, let's cut it by 50%. And what I have found is as we start to teach people and people start to feel better, they just start doing it on their own. Like so many people have come in and said to me, oh, I gave up the soda altogether, or, oh, I gave up the alcohol altogether, right? Because they realized it wasn't serving them.
And it's pretty remarkable when you start this way and asking people to do, what do you think you can do, right? Because that motivational interview is very, very helpful, right? Where do you see yourself capable of doing, in your next week, in your next month? Where do you see yourself, 5 weeks from now, 6 months from now, being able to do what? Walk more, drink less sodas, so being able to have more energy, to feel less depressed. So in that motivational interview, you can empower someone to say, hey, I can see myself doing that, instead of that, do it all, right? The change of your lifestyle tomorrow, which is an impossible task. It's not a reasonable task to ask anybody. So, and you see exactly what you described. The people come back after the initial, I don't know if I can do this, but they can. They see themselves actually able to do that. And that is the first beautiful step for this healing journey. And when they start to trust themselves a little bit more.
Absolutely. And what you said is very important, is getting people to reflect back. Well, if I did this, I might feel what? I might feel less arthritis because I've given up sugar or too much dairy, or I might be able to move better if I weigh 30 less pounds or bend easier. And also, what is the reason for change, right? Like most people don't say, I'm going to change because 10 years from now, I don't want to have a heart attack. If they just came out of the hospital, then they're frightened. They'll pretty much do anything you say for a while. But But then we all need an anchor, right? Why are we going to change? And like I've had people say things like, I want to go to my grandchildren's graduation. I want to feel fit in my tuxedo for my daughter's wedding. I want, people have real reasons in life to remind them of why they're doing this. And I think that's important too.
Yeah, and as you brought up the Dean Ornish program, and as you know, I ran the program for Atlantic Health, and I was always amazed, especially in the beginning, about we did nutrition, exercise, and but the groups that were formed, and they're still these groups. Most of them are still together for years and years and years. They become a family, and the love they have for each other. I mean, that really shows the really powerful impact of connection and love. It's just amazing to me that how healing that is.
Well, love is a secret ingredient, but thanks to us, it's not so secret anymore. But that's one of the reasons I refer to cardiac rehab all the time. Imagine if you have a cardiac event, a stroke, a heart attack, a bypass surgery, whatever it is, all of a sudden you go home with this new quote unquote diagnosis, 6 or 7 medications, and you're afraid to even move. I mean, people say to me, I was afraid to even get out of the chair. And once we get people into cardiac rehab, like you said, they have 20 new friends. The nurses are taking good care of them, making sure their blood pressure's fine. They get confident as they're on the treadmill and on the bicycle, and they have a community. And I think that, the W-E in wellness is really we. It's that we. And going back to what Sandra was saying, the I in illness is really isolation, right? I'm going to go home and I'm alone and I don't have support. I mean, there's no worse place to be.
And that is with that community, with the cardiac rehab, you probably decrease significantly the incidence of depression that we see after MIs and after heart attack. Because if you become part of a community, you are with other people that have been through the same things you have. You're not as scared, because part of people feeling frightened is this is happening just to me, right? I messed up. I did this to myself. And recognizing that, okay, we're all in here, right? That we're all a little bit victims of the society that has provided us with the wrong tools, with the wrong messages, with too much work, with less communities. And then you realize, okay, we can do this. It's possible.
It's possible with the support, and you're absolutely right. And I think we're going to reach a point where it's going to be peer education. People in communities are going to be teaching other people. It's like if the 3 of us would go and teach a group, and then that group would go and teach another group, and that group would teach another group, right? Sort of like what they did north of me with the Daniel plan, right? With the minister who the congregation was so large he couldn't baptize people. And, he brought in a couple of doctors and said, what could we do here? And they made "My body is my temple" their motto. And they lost, I don't know how many hundreds, 500 pounds or something, even more than that. They transformed the entire faith-based community. And it wasn't doctors doing it. It was doctors giving the information and nutritionists in the beginning. But then it was the people taking it over and teaching each other. And I think that's something to really be said for that.
Yeah, it's, I think there was a study looking at asking people going in the cath lab for a heart attack, whether they had a connection with someone, a spouse or something. I think that connection made them, their outcomes much better. I don't know if you know about this.
Absolutely. And all of Clecott Glazer's work on people under stress getting vaccines versus not under stress. We say, well, people couldn't even mount the vaccine response when they're under stress, medical students and so on, caregivers, healing simple wounds when people are under stress. the beautiful study in JAMA looking at putting the rhinovirus in people's nose and looking at their social network. And the people with the best social networks, the highest number of connections, were least likely to get sick.
That's right.
So with the immune system.
It's just so the stress affects immunity. Yeah, that's a good example of that.
And it would be interesting study to look at the microbiome of the people that have more connections also. What does it look like compared to the microbiome of the people that are alone and lonely? That would be a great study to have.
And this is what we always tell patients, is that we're part of an ecosystem, including our microbiome. And so that ecosystem includes other people around us. So I'm sure the ecosystem affects our microbiome. This is part of the whole process.
Just like stress affects our microbiome, right? For sure. And that has been proven. So no doubt about it.
And one of the recent studies I looked at is that the microbiome of centenaries is actually a young microbiome. So it's like their microbiome doesn't change much over time. And centenaries tend to be people that have a lot of connections, that live in big communities.
Yeah. That's fascinating. And I think someday we might be taking stool samples off the shelf and injecting them into people like we do for C. difficile.
Correct.
Yeah.
Correct. And that can probably take care of depression, anxiety too, right? Because we see that with...
Well, this goes back to how you said you grew up and the Roseto, Pennsylvania group of people. And we know in Italy, as an example, there are groups of centenarians. They have their family, they have connections, they go into town, and they have other connections. So they're intimately connected. As opposed to sometimes here in America, we're isolated. We're in a car, we go someplace, we don't really have these connections. Like my aunt in Italy, she still goes out and shops, like from one shop to the next, knows all the shops, and this is much different than advanced Western society. So I think that is part of the problem. Part of the problem also is the children. Our children are stressed, and they're stressed in little ways. Like they're they have to get up early to go to school. They have to, and there's childhood trauma, and this creates problems as adults.
Now, I couldn't agree with you more. And this, Sardinia has one of the few blue zone communities in the world, right? And I think it's all about lifestyle, right? And it's all about your community and also your purpose in life, right? Why do you get out of bed in the morning? When we talk about the blue zone communities, they seem to have a couple of things in common. They have, usually an anti-inflammatory diet, right? Like they do in Sardinia, or the Seventh-day Adventists north of me, right? Lots of nuts, vegan diet. They have a lot of spiritual connection, whether it's religious or spiritual. They have this social network, as you're describing. People come out and they know everybody. The other thing that's happened to us is we've also, the industrialized food revolution has really changed our food. When I was growing up, we went to the fruit and vegetable store and we got fresh fruits and vegetables multiple times during the week. We didn't just buy one big pile of things and have it for a week or two, right? We went to the bakery and we got fresh baked goods. There was a whole different way of being. And sometimes I often think about maybe we have to take some things back to a more simplistic method. We didn't have 1,000 channels on the TV. We didn't have a cell phone where the kids are on TikTok and these other things all day long instead of interacting outside on the playground with other children, right?
Or nature, even better. Get the children out of nature. Our son is he's a permaculture farmer in North Carolina, and his focus is creating soil that's super nutritious, instead of just organic, which is pesticides, just creating the soil. And, and what you were talking about reminds me of Sandra when she first came from Italy. She was a little shocked when she went in supermarkets because
It was very confusing for me. I entered a supermarket and I felt completely disoriented. I couldn't figure out what time of the year was because everything was present. Oranges and apples and figs and everything was there at the same time. And that was not my experience at all. I always knew what season was every time I entered a fruit stand, a place where to buy. I knew exactly where it was and what time of the year it was. And it was really very disorienting.
Yeah, so seasonality of foods, I think, we feel is very important.
Agree with you. And I think that's a great story, Sandra, because that really hits home. And then you have to say, where's that food coming from? How far has it been shipped to be here?
What is the nutrition content of that food? By the time it arrives to us, it might look beautiful, but the nutrition is not there, and we're missing out. We're right? We're not feeding our children well. We're not feeding ourselves well. We're not getting what we need in order to feel happy. A recent study that coming from England, they looked at 9,000 children, different schools, different socioeconomic background. And what they figure out is that the kids that in the end were the happiest kids are the kids that had 5 to 6 servings of fruits and vegetables per day.
And it makes total sense. I went to visit Finland schools once, and people may not be aware, but Finland is ranked number 1 for reading, mathematics, as well as for happiness in the world. And when you go to a school, typical school, the children are eating fresh food. There's real baked potatoes, real berries, real salmon. They're not eating stuff out of cans and bottles.
Like every season.
Right? Everything is fresh, just like you're saying. And also, the teachers there have to have a master's degree. You can't to be a teacher is a very high-ranked profession. It's one that has a lot of recognition. And a teacher is assigned, by the end of the year, the kids should know how to do this, this, and this. And it doesn't matter how you do it. Like, you can take they'll take the kid outside and have them do the diameter of a tree, right? Or measure the height of a tree, out in nature, as opposed to the way we're doing. We need to learn from these countries.
Absolutely. Very, one of the things I always thought is like we as physicians, with the limitation of our learning and teaching, but at least after we graduated, we have to do training. We're not just on there, but teachers don't, right? They graduate and they're teachers. They go into a classroom. And that makes no sense, right? Makes no sense whatsoever. Not had that training. But, this has been wonderful, lovely.
And thank you. And our listeners are going to really love this.
Let's do it again. It's so good. I love to chat with the two of you.
We appreciate your wisdom. We appreciate your time. And thank you for everything that you do outside of your practice. All that you give to the world. Thank you.
Hope to see you soon. Bye-bye, Mimi.
Bye-bye.